this video, I'm going to discuss the markings of the skull bones. I have a separate video that goes over the actual bones, and I mentioned some of the markings in that other video as well. First, we're going to talk about the ethmoid bone. So the ethmoid bone, if we get into the nasal cavity here, you can see this structure coming down. I don't know how well you can see it here. I'm going to come over to this model. You can see it a little bit better. In the nasal cavity, this that's coming down, this is the perpendicular plate of the ethmoid bone. Now, for the other structures of the ethmoid bone, I'm going to have to take off the skull cap, the calvaria. All right, here's the calvaria has been removed, and this is the anterior here. And this little red that you can see here, this is the ethmoid bone. Where my probe is right now, this is the cribriform plate of the ethmoid bone, and this is the crista galli of the ethmoid bone. Also, while I have the skull cap off, the calvaria off, this bone here, this is the sphenoid bone, and this is the lesser wing of the sphenoid, and then the greater wing of the sphenoid bone. So you would not see that very well with the calvaria on. Also, while we have the skull cap off, you have this little indented area. This is the sella turcica, which is where the pituitary gland would sit. All right, now we're going to go back to the outside, and we're going to look in the orbits of the eyes. So some other structures of the sphenoid that you need to know. Back of the eye, towards the medial aspect, you can see this hole. This is the optic canal, which is where the optic nerve would travel through. And we could actually look in the top of the skull as well, and you can see where my probe is coming out. That's the optic canal. And then if we look back in the orbit of the eye, in the back, you can see these elongated gaps. Those are also part of some structures you need to know with the sphenoid bone. You have the superior orbital fissure and then the inferior orbital fissure in both of the orbits. Superior orbital fissure and then the inferior orbital fissure. Okay, now I've got the skull cap put back on. We're going to focus on the frontal bone. So this is the frontal bone here. The markings you need to know, the supraorbital notch is a notch on this particular model. You need to look at different models in the lab. And so over here, if we look, you can see a little hole. It's called the supraorbital foramen, or the supraorbital notch. It's very subtle on this model, but it's just a little notch. You can take your finger and you can feel it. This little notch above the eye here, where the eye would be. And here is an actual hole. Now, the only other thing we have for the frontal bone that you need to know is the frontal sinus. However, you have to have a cross section or a sagittal section of the skull to be able to see it. So here is a picture that shows you the frontal sinus that would be in the frontal bone, but we do not have any models depicting that in lab. Now the occipital bone, so we're looking at the back of the skull here. The bone is sort of orangish colored, and there's a little knot in the back. That is the external occipital protuberance. And on the inferior surface, I'm going to actually turn this around. So this would be anterior, this would be posterior. You can see this very large hole here. This is the foramen magnum. The foramen magnum is where the brainstem would come and be continuous with the spinal cord. And then to either side, and it's roughed up here, but to either side, there are these little projections to either side of the foramen magnum. Those are the occipital condyles that would articulate with the first cervical vertebrae. You can see the condyles a little bit better on this particular model. So right here, where both of my fingers are, those are the occipital condyles. Okay, now we're moving on to the temporal bone. So this is the temporal bone here. If we look at this model, his skull cap's off, but this is the temporal bone. So here you see this hole, this is your ear hole. That is the external acoustic meatus. If we go a little bit anterior, pointing to the anterior, and I'm going to show you on this other model too. So here you can see the external acoustic meatus, and this structure that is protruding anteriorly, that is the styloid process. and then this large bump. If you take your fingers and you rub behind your ear below, that large bump is the mastoid process. Here's the mastoid process on this model here, this large bump, and it'd be posterior to the external acoustic meatus. Now if we look here, you can see where the temporal bone contacts the zygomatic bone. This is the zygomatic process of the temporal bone. If we look at the colored skull, you can see it a little bit better because of the delineation between colors. So this sort of purplish color, that's the temporal bone. The bluish is the zygomatic. So the temporal bone meets the zygomatic bone. This is the zygomatic process of the temporal bone. Now we're looking at the inferior view of the skull. So again, this sort of purplish, that is the temporal bone. And you have the external acoustic meatus. This is the mastoid process. This is the styloid process. As we move medially from the external acoustic meatus, we can see another large hole here. This is the jugular foramen. The jugular vein is a huge vein, so we have to have a very large opening. It's a jugular foramen. Let me show you on the other skull. So here we have the external acoustic meatus. We're moving medially. Here's the styloid process, but then this very large hole that would accommodate the jugular vein, that is the jugular foramen, as we're moving towards the foramen magnum of the occipital bone. The only other structure on the temporal bone is the mandibular fossa. I'll show you from a lateral view in just a minute, but this indentation, which is where the condyle of the mandible would fit in, this is the mandibular fossa. On this other one, you actually have a plastic pad, which is where the mandible would fit, but it's a large indentation. That's the mandibular fossa. While we're on the inferior view, we're also going to look, so this is the maxilla, where this would be your upper teeth of your upper jaw. These are maxilla, two bones, two facial bones. These are the palatine bones. So where the maxillae can connect with the palatine bones, this would be the palatine process of the maxillae, where the maxillae come into contact with the palatine bones. So here we've got this wire, which is where the mandible would fit in, but you have the maxillae here, and then the palatine bones, and so this would be the palatine process of the maxillae. Also on the maxilla, you have, so here, your upper jaw bones, those are the maxillae. You have these small holes below the orbit of the eye. These are the infraorbital foramina. Foramen is singular, infraorbital foramen. Okay, now we're going to go to the mandible. This is the mandible. So this would be the body of the mandible, and you can see the little holes in the chin area. Those are the mental foramen. Foramen is singular, foramina is plural. The mental foramen. This is the angle of the mandible, and this is the ramus, where the ramus juts up to meet the temporal bone. That is the ramus. And then we have these processes here that articulate with the skull. Here's the mandibular fossa that's on the temporal bone, and this is the mandibular condyle, or the condyle of the mandible. So that's going to be the more posterior sort of projection, superior projection of the mandible. And then here, this is the coronoid process of the mandible, the coronoid process of the mandible. And then between the coronoid process and the mandibular condyle is the notch, the mandibular notch. Okay, so that's going to be it for the markings of the skull.